So today's update, of course, we were thinking maybe my mom was going to be discharged. And when I went yesterday, they had a new doctor, shift rotation. I'm sure that's a typical thing, but the new doctor um, actually had a conversation with us, and we were able to ask the questions that we were curious about, with the fluid building up in the lungs and how fast, and what happens if we send her home and then this is building up that fast. And so really gave us some qualifiers as to the amount of fluid, and while it seems high to us, not high to them. While it seems like it's fast, maybe not so fast, but obviously something worth checking into. And during that time, my mom began to cough, which she's had a little bit of this, what was a dry cough, but now she's actually spitting up some mucus. And sorry, I know it may be gross to some, sometimes it's gross to me, but it was important that the doctor actually honed in on that and said, well, wait a minute, how long has this been going on? And we said that it just started the day before. Of course, that was the day that we felt like she really didn't have the energy. Everything just seemed to kind of go backwards a step. And I related it to when she had COVID for the first time. She was down for 6 weeks. I mean, obviously she was self-treating. She didn't go to a hospital. And, we know that a lot of this was just rest and do what you have to do. She had been vaccinated all throughout the course. But this is the thing that seems to be, where I can draw a conclusion. Obviously, I'm not a doctor, which I said to him, I'm not a doctor, but here's my concerns, and here is what I want to have answers for, so that I know I can comfortably and assuredly take care of her as to the best situation. And that raised enough questions in his mind, looking through the information, through the chart, that he began to order a couple of things. So he wanted to do a culture, and he wanted to send the sample down to have it tested. Well, amazingly, I am just blown away by, COVID was such a serious thing, and we really have gone past where it's not really talked about. It's not really any consideration. Once in a while, you'll see people walking around with masks, and the reality hit me that, I've been coming into the hospital from work, from my day, and then going out from the hospital to my work, to my day. And I should have known better. I should have been masking up anyway, just because the normal viruses and exposures that you potentially can get never ever even dawned on me. This is how far removed we are sometimes when we're so focused on the one thing. Everybody is trying to figure out if it's lymphoma, what type of lymphoma, what do we need to do? And from their standing on the hospital, obviously, is hey, she's been here for 8 days, it's time to get her discharged, and everybody goes down that path. In the meantime, we're noticing as the family, something's not right. She is not doing what she was doing. Like, she was making progress, now she's not making progress. So, somewhat long story short, comes back and my mother is positive for COVID. I am blown away. I just did not realize. And of course, her partner, roommate, is now positive, because we said, well, everybody who's been here needs to test. One of my sons, now positive. And it's like, holy moly, what in the world? Why wasn't there a precaution? And I get, maybe they don't run those panels when you first come in, because your signs and symptoms are something else. The test results are pointing towards something else. But this was really a very important lesson for me to reinforce in my mind. When I go to visit my aunt, I have put on a mask when I go into the hospital, and I take it off when I come back. And it was just a normal part of, I know I don't want the exposure, and I don't want to bring in the exposure that I may have had from my daily stuff. And here I have not followed my own rule, and I'm beating myself up, of course. But in this case, we don't know where or when she got it. It appears that it came along maybe somewhere along Sunday late, Monday morning-ish. But certainly the symptoms started setting in there, and we were able to finally call it out to someone who listened and is now going to take her down that path of getting that taken care of, the rest and the recuperation that she needs. So just remember, sometimes you know yourself better than doctors. Yes, they know the medical, they know the diagnosis part, they know the treatment aspect, but you know your own body as a family member. If you are that tuned in and you know how your family normally responds, it's important for you to speak up for them, especially in my mom's case. She's not really able to communicate a lot because she's so winded and tired, that if I didn't ask those questions, if I, and I did it in a nice way, I'm not trying to be impolite, I'm not trying to be rude or overbearing or anything like that. Imagine that. I know some of you are thinking that's impossible, but it is true. It's just that I want to have answers so that I know how I can care for her, so that I know what I can do for her, because you're releasing her to me and now she's in my care, and I need to know as much as I can, but I also understand and appreciate her as a person and know that this is not normal for her, and that's what I could go off of. And I'm so thankful that they asked the questions and listened and did the further testing. So don't always take it for 100%. Certainly raise and ask the questions if you have them, and more importantly, do ask about the specifics of what you need to know in order to feel like you can take care of that loved one. And ultimately, it does take a village. It takes the medical professionals, it takes the people who are skilled at the care, and it takes the family members to love and support, so that the patient doesn't feel like all things are lost and they have something to look forward to. So that's my story for the day, and we will see, as this is an ever-evolving thing going on, what comes next. And we'll keep you posted. Thanks.